Hearing loss can have two forms. One is when the nerve that does hearing diminishes function, and the other hearing loss that people get is actually not a nerve loss, but just inability for the sound to get into the ear, and you perceive it as a decreased ability to hear. The symptoms of hearing loss can vary. Most people obviously will have difficulty hearing loved ones or background noise, that sort of thing. Sometimes people wind up with ringing in their ear, and their primary symptom turns out to be ringing or tinnitus. There are many causes of hearing loss. Most often we see hearing loss with either noise exposure, either from military, loud sounds, industrial work. Another cause can be infections. Small children tend to have a lot of ear infections. That can actually cause a hearing loss. And then even, odd infections and tumors and those types of things. So the most common form of the hearing loss is the noise exposure hearing loss. That certainly can be prevented. So we instruct all of our patients to have hearing protection, even working around the yard with a 2-cycle engine or weed whipper, that type of thing. Use an ear cup or at least an ear insert. And certainly people who use recreational firearms preserve the hearing that you've got, and that'll help. We do, and interestingly enough, we're actually seeing more hearing loss in young people now due to the earbud use and a lot of loud sounds with various personal audio devices. Most often, hearing loss is diagnosed by a visit with an audiologist. We do a preliminary hearing test, which is not merely just the ability to hear a sound, but we also test the ability to hear speech, more real-world environment than just hearing the button. You're hearing the buzz and hitting the button. So after a hearing test or an audiogram, we're able to then assess what type of hearing loss is occurring and how best to manage it. So if somebody needs a hearing aid, they would be able to tell due to their circumstances in their world around them. If they have inability to hear conversation, if they have difficulty in background noise, either a loud restaurant or a cocktail party. So not just because they have hearing loss do they need a hearing aid. It's not only the severity of the hearing loss, the type of hearing loss, and then how much it actually handicaps them in their activities of daily living. Sometimes we find people who are just in the beginnings of hearing loss, and they may have truly hearing loss, but they're not in need of a hearing aid just yet. There are other people who have hearing loss that actually can be corrected surgically. There are a number of insurance companies now who are coming up with what they call a hearing aid benefit. And so they will provide a certain amount of money towards a pair of hearing aids. If people are in the military system quite often and they become service connected, meaning their hearing loss is related to their service, hearing aids can be covered. Hearing aids are often covered if they're related to a medical disease. So if somebody has a tumor or an infection or hearing loss as a result of chemotherapy, quite often hearing aids are paid for by insurance in those instances. I think there's really two classes of hearing loss. One is certainly in the adult population, and those are people with, we talked about, noise exposure, familial hearing loss. Sometimes people just lose their hearing in their even 30s and 40s due to familial issues. And then there's the young child hearing loss, which is unfortunately preventable. Most of the time it's due to infections. And a lot of times it's the teacher who talks to the parents and says, I just don't think something's quite right, and then evaluating that. Many times it presents in a child not due to hearing loss but due to speech delay. Quite often we'll find a child who's just not speaking and articulating like they should with their age-appropriate peers, and we find out it's not necessarily due to a speech issue, it's more of a hearing loss.